growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi, everyone. Welcome to the Lionhearted podcast. I'm Dr. Steve Rasner, and I want to begin this week by saying the following. Right now, I know some of you are listening in your car. Maybe you're in your downstairs gym in your house because we can't, in most places, go to the gym the way we used to. Wherever you are, maybe you're a dental student and you're listening right now. This is what I want you to know. Whatever we do in life, sometimes we're more focused on it, and we probably do a better result of whatever we're doing when we're focused. I feel like I'm laser tuned in right now to this podcast, to these podcasts. So before I come on and do these, I try to picture where you're at. I really do. And what will it that you hear, or if you're watching, what is it you'll see that will really change you? I mean, why else am I doing this? So I want you to know that's my mindset before I say a word in this week. Last week, I spoke to you about training. It was my first real live 2021 podcast. And I thought before I went on that one, what's the difference maker in the Lionhearted practice, in my practice? What is it that allows me to have such consistent outcomes, such good weeks? What is it that allows me to have such success in case presentation? And look, I know there's a lot that goes into that equation of people saying yes to you and willing to invest their hard-earned money to improve their oral health care. Everything I've brought into these podcasts, from the podcast about how you handle the new patient journey from the first phone call, the branding, your advertising that you put in your community. Yeah, every one of those things I believe is necessary. But I really believe it begins, and I think the beginning of training, of committing yourself to be better than you are right now, accelerates all those other things that I'm talking about. And if you go into an operatory and have everything else in place, you have a perfect new patient coordinator and a perfect flow from that first phone call, exactly like mine, back into an operatory. If you don't have the confidence in yourself, if you don't really believe in yourself deep down in, then I think it's a possible cause of lack of case acceptance. And case acceptance is everything. So that's what I'm really trying to focus on early in these podcasts in 2021. I want to hear from someone or know that it happened, that you listened and that was the light that went on. You know, I want to tell you something rather personal. When I started speaking in 1998, so I guess that's 22 years ago, I was told, and I believe it's true, I was very motivational. I wasn't known because I had this amazing new bone grafting technique or soft tissue grafting therapy that I developed. I would like to tell you that because there's a side of my personality and my brain that wants to be acknowledged as very, very good clinically. And I think I'm okay. I think I'm good. Certainly there's many clinicians watching this that are better than me. It wouldn't be because I don't train, though. It wouldn't be because I don't try really, really hard to always improve and provide the best of myself. But some of you guys are just gifted. But I came off very motivational. And I did because it's beyond the scope of this podcast and maybe ever, We all have stories and journeys behind us, right? Well, my journey was very, very challenging. It doesn't matter. I think I'm qualified to get in front of you, either through this vehicle right now or a live audience, and speak about overcoming obstacles in life and reaching optimal full potential, despite some very negative things that could have happened. And I've had a myriad of them. And that's what drove the motivational side of me, I believe. And that's what I think people heard. And over the years, to be honest with you, especially in the last 10 years, that's why I'm telling you this is personal, I kind of backed off on that because a lot of reasons why I did it. I wanted to believe, and I do think it's true, that the heart and soul of any successful dental practice is to be clinically excellent. And so what were those things in my practice that I thought were clinically excellent that I could teach? And in my particular case, I focused a lot on surgical procedures and, as you know, sedation procedures in the last 10 years of my career. It doesn't mean I'm not still motivational and could inspire you, because that's my whole point. I want to be that for you. I know I'm very capable of doing it. The reason I did this podcast is because I would do podcasts for many of the leading podcasters that you know of. Gary Tackett, the guys down in Atlanta, I can't think of their names right now. The biggest. And every time I did one, I would be inundated with emails. And they would tell me that. The host would say they got a better response than any guest that they ever had prior to me. And please, for a second, don't think that I think I'm this great, because I'm so critical of myself. Whenever I get positive whatever, it's gone in a short time. I'm only telling you that because that's what drove this podcast. I said, well, gosh. And I did them for about 3 years. I did dozens of them, a dozen of them. And that's how I got to you. And I know I don't have any guests at this point because I don't know. I thought what we would do, and I've said this to you before, is have this chat as if it was after work one night, like a buddy of yours, or at the end of the work week where you get together. There's so many vehicles on social media to already talk and share clinical tips. And I even flirted with that before, and I'm not going to say I'll never do it again on this podcast. It's just there's so much of that out there already. I feel like part of my purpose is to put the whole thing together for you, to keep it in perspective. And I guess I'm sitting here explaining of why I haven't been more motivating with you. And I want to be. And the reason I want to be, again, that I'll introduce through these podcasts, it's not hard for me, I just be myself, to be honest, is because what you hear me talk about is absolutely what I live. You need to know that. You need to know that when I walked in my practice on January the 4th, 2021, in my head, I had taken off 10 days. I was not in the mood to go back. That's really the truth. Because it's a level of stress, even when it's running well. It's certainly less stressful to play tennis every day, or to lay on a beach, or to go on a boat. So even in the best of practices, we feel that. Oh my God, I'm going back into the arena. I'm like, really, the analogy to me was like a gladiator, which is fine. But in thinking about what I used to talk about over the years, and by the way, it wasn't my imagination. I was invited to do many, what do you call it? I can't even think of the name anymore. To be the lead speaker at many non-dental. Some of them were huge. Fortune 500 company type of things. And so here I am with you. And the first thing I want you to know is when I did come back on the 4th, everybody seemed a little hungover, including me. I don't mean literally, and I find that always to be the case. So what did I do about it? Here I am, and I wasn't in a mental mood. I'm in a much better state right now after 1 week back. I am. And that's the result of being fortuitous to have a very successful opening week of the new year, where all the principles I try to share with you each and every week were reinforced, were affirmed, were in play to make it an excellent week. It wasn't an accident, trust me. And it was an extraordinary, maybe the most successful opening week I've ever had in 40 years. I worked 4 days, had significant production and collections without working hard. That's the beauty. So this is what I came away with for this week's podcast. Last week I talked about training. So the first thing was, yeah, it is a little bit laborious because doing the Lionhearted practice, because it also requires you to be a leader. So I got my team together early in the week, even though I wasn't in the mood. And I said, listen, guys, I know everybody would rather be still on vacation. Here's the problem. Even if I and I treated them very well during the latter course, all of 2020, but particularly generous towards the holiday seasons. And, we were closed down for 10 days. And I said, I know everybody rather probably extend that. I get it, but we can't. We own a business. That's how I talk to them. And we operate. And I can't have you show up 3 days from now, a week from now. I need you and your skill levels, which is why you're with me right now, like today, not even tomorrow. So what does that literally translate into? I need you to be on your game on everything we talk about every week, every month, every year while you've been with me, no matter what department you're with. Spotlessly clean office, confirming patients accurately, knowing what we need for those visits, remembering all the things that have personal connections and have the relationship-based practice. The thing I'm telling you guys, that's not even really a lot of effort with my staff because it's expected of them anyway. That's why I hired them. That's why we trained them and invested in them and tried to get people that enjoy doing that it's not an effort to be connected with our patients. But it's easy when you've been off to get a little lazy, and I'm just going to say it the way it is. So here's what I want this year to be dedicated to you, at least in the beginning of my podcast year. I want we call this year the year of you the expert. The common denominator of all successful people, I don't care, I'm not talking dentists right now, if actors, athletes, businessmen, is hard work. It's just hard work. It's the story after story that you could go online and read about, and you should, because it inspires me. It inspired me at my lowest times in my life of not giving up. Some of you didn't experience a great 2020, right? I mean, we all had the unbelievably savage effects of the pandemic that's still here, very much here. I understand that. I'm talking beyond that. Your dentistry, your lack of case acceptance, your moth-eaten hygiene schedule. A lot of you experienced that last year and haven't been able to put it together, and I'm here to help that. And the first way for me to help you do that is not give up. You hear me say on these podcasts, nobody's coming to rescue you. They're not. If you're waiting for an inheritance, then you're listening to the wrong podcast. Last week, I started out with a couple quotes. I used to be the king of quotes because I loved it. It motivated me. When I did those talks earlier in my career, I would have these beautiful slides with quotes that inspired me. And so I'm going to give you two. I gave you two last week. I don't just give you anything. I give you the ones that resonate to me before we talk about what the focus is. When the focus is the year of you becoming an expert at some particular aspect in your practice procedurally, where you are so confident of that. And it is the beginning of a lifetime commitment where you master one aspect of clinical dentistry after the other. If that doesn't sound exciting to you, then maybe you're not listening to the right podcast. That's what the Lionhearted Dentist does. That's why I'm able to get in front of you today. There's no other reason. That's where my good fortunes have come from. Bobby Knight of the Indiana basketball team that was legendary. He had some problems, by the way. He's the guy that threw chairs and things like this. But he did say some interesting things about success. And he said, the key, and this is for you and I, you're a dentist right now, you want to get better. The key is not the will to win. So for you and I, the key is not the will to want to be successful. Everybody has that. It's the will to prepare to win that is important. It's the will to prepare to win. So are you willing to train? Are you willing to work harder? And I'm going to give you one more before I get off on that. The greater the danger for most of us is not in setting our aim too high and falling short, but in setting our aim too low and hitting our mark. That means never thinking out of the box. That means never really realizing your potential. It's the truth. I bet you if I went back in my mind to dental school, I was the guy that sat in the back of the auditorium. If I repeated dental school today, I'd be in the front 3 rows. I would, because I wouldn't want to miss a thing. But wherever I was in my mid-20s, I was the guy in the back. And I bet you if you asked many of my classmates, they would be shocked at whatever I've achieved, as was I. Not that I wouldn't have a successful practice, but in the clinical mastership of many procedures that I've acquired through the vehicle of CE that I'm begging you to act upon in 2021. Don't think about it. Do it. That's the key. And I went back. One more thing I want you to think of motivationally. Look up this guy on YouTube. His name is Eric Thomas. And I love him. And he tells a story. He tells many stories he's famous for. But one about this guy that wants to be the most successful guy in the world. And I don't know if he rubs, I don't remember the exact how it went down. But he rubs a genie and this guy comes out and says, you want to be the most successful guy in the world? Meet me on the beach. I want you to hear me on this. He says, meet me on the beach. And the guy in a 3-piece suit is thinking, meet you on the beach? Why would I meet you on the beach? He says, meet me on the beach tomorrow at 4 a.m. or 5 a.m. So the guy wanted it bad enough that he, even though he thought it was crazy, he went to the beach the next day at 5 a.m. And the master that he wanted to learn from to be as successful as him was there. And he goes, walk with me. And he walks into the water. And long story short, and I won't ruin it for you, for me to tell you this, he gets to the point that he's in the water up to his neck. And then he's underwater. And the master would pull him up. And the motto to the story, as I'm leaving out a lot of verbiage, was, when you want to, he says, what were you thinking of when you were underwater, when I kept you underwater? What were you thinking of? And the fellow that wanted to be successful says, I wanted to breathe. He says, when you want to be successful, as bad as you wanted to breathe, is when you'll be successful. See, the point is, all of us, and Eric Thomas expounds on this, all of us want to be successful. But maybe you want to sleep more than you want to be successful. Maybe you want to play golf this weekend or tennis. I'm talking about those of you that haven't trained, that haven't paid the price that every successful, really successful actor, athlete, businessman have paid. Maybe you haven't paid your price. And remember something, the reason I'm telling you this is because one epiphany I'm having, I always try to think, how can I get you to be more successful in the operatory room closing cases? And I don't even like the word closing because I don't want you to force people or trick people into treatment plans that they don't want. And I'll try to get back to that point in a minute. I think one of the things I never thought about is part of my success in the operatory, presenting cases, getting to yes, comes from the really unbelievable self-confidence I have in myself in doing procedures, in figuring out what a patient should really do with a given mouth, with a given situation. I really do. I mean, I knew it made me good at doing everything from an implant to a denture to understanding occlusion and all those things that are part of our daily practice. But I never thought about it that it emulated itself and came out in my words and my behavior and my body language when I'm presenting a case to somebody. You can't fake confidence, right? So when I look at the end of this past year of 2020 and the beginning of 2021, everything that happened that resulted in it, I mean, I killed it in December. I'm not telling you that to sound like but I think it's important that if you're going to follow me, if you're going to be a Lionhearted dentist, that you know these things work. Everything that happened was not the result of skills I got in dental school, with all due respect to all the dental schools out there. They just have 4 years. I couldn't do any better job, I don't think, preparing you. And they don't have the time to give you all the clinical information that is required. I think all of us know that. So there's things that happen when I look back over the year, and I look back over December and even the opening week. You know, I had a patient in the chair. I think about these things sometimes, 4 o'clock in the morning. Not when it was happening, but later. I had a patient that I was having trouble achieving proper anesthetic. A block, which, to be honest with you, my blocks, earlier in my career, I would get hot and cold. They've been pretty spot on for more years than I can remember. But I can go right into a Gal Gates procedure without even knowing that I'm doing a Gal Gates mentally. Like I gave a conventional block, whatever reason, their anatomy felt a little odd, I felt, and that's from training. That's where that came from. I had somebody in the chair, I took out a wisdom tooth on this patient. He didn't flinch. I go to do endo on number 7, pretty easy tooth to anesthetize, correct? And he was hot. I couldn't believe it. I tried my tricks that I use. One of my tricks is I blanch over the root with articaine. Besides a regular infiltration, I'll go mid-root on the buccal and blanch it with articaine. Didn't work. And I just turned to my assistant and I said, we still have that Stabident, which is an interosseous injection. You know, it has a drill that goes into the bone and then has a orifice to inject a little anesthetic directly into the bone around the area you're trying to get numb. I didn't even remember that I had the system, but that's up there from the time I trained in Stabident. I don't even know if it's still called Stabident. And these things that I do daily really come from a wide array of CE over the years. One of the giant treatment plans I had in December was a very nice looking 50-some-year-old female who didn't wear any teeth. I mean, she had no maxillary teeth, no denture, because she had an incredibly shallow palate and there was no retention. I didn't make the denture, and it wouldn't matter if I did. I couldn't probably have done anything successful with her. So I did a CBCT on her, and she had adequate bone width but needed vertical augmentation. Now, I'm in a southern area of New Jersey outside of Philadelphia. Nobody in my vicinity that I know of does vertical bone augmentations, but I know how to do it. I know how to do it because I've invested a lot of time with, to be honest with you, Mike Picos from Tampa, Florida. And he has an incredible course. It's very expensive. It's 4 days. I've taken it at least twice. It was like $6,000. I don't know how many years ago I did that. I know I retook it about 2 or 3 years ago. And I'm not saying I have that rock solid cold because I don't do it that often. But I knew the solution for this patient. This was a very, patients can sometimes impact us, right? We can relate to them. And any one of you would have liked this patient and would have liked to help her. The question would be, would you have the skill set to take a block of ramus from the ramus shelf and screw it onto the maxilla and then wait 5 months for vertical augmentation to complete? And all the other things you hear me talk about, the documentation to make sure it's superb. All this comes from the bedrock of CE. It does. It's impossible for you to commit a couple years, I would suggest, to Spear Institute, or if you're into surgery like I am, and take an array of courses that I would suggest. It's never just wherever you're learning. You meet other like-minded clinicians, and they tip you on, you ought to look at this app, or check this out. And it's impossible for it not to spill over and make you a better, complete doctor on all your services. I spent many, many years training, and I don't know how to get up in front of you and be genuine without telling you I think it is a lifetime commitment that you need to make. I don't consider myself a nerd or even but I am. I love to learn. And when I'm in the classroom, I forget how much I love to learn. And I take that back to my office, and it lasts forever. It doesn't last for a week, it lasts forever. Not everything. I remember 10 years ago, I took a course in Botox and lip fillers and all that, and, it wasn't for me. A lot of you listening probably have a big prep, do way more of that than I, because I don't do any of it. So it's not everything. Here's what I want to tell you before this session's out. Write to me at drrasner@aol.com. Now hear me out on 2 things. 1, ask me for my recommended residency. I haven't given it out in a long time, and I'm not telling you it's a Bible, like you have to take the courses that are on there. It's a good format for you to follow. You should be looking right this second in January at courses you want to take throughout the whole year. And think it over for a couple weeks. And then commit to, I used to take a continuum, which is a 2 or 3 day course, 3 of the 4 quarters, if not 4 of the 4 quarters every year. And then I would throw in a couple 1-day courses. That's what I did for many, many years. And that's, when I tell you that you need to train, let's be specific. This is what it looks like. It looks like you getting on a flight after working 3 or 4 days, okay? Going somewhere that you paid for a flight and a hotel, wherever you're going. Take your family if you can. Sometimes you must take them. It does you no good to follow my recommendations and become this great clinician with this amazing office and 10 years from now. And one more thing, you have a divorce. That's not the goal. Okay? That did happen to me. So I'm brutally honest in these podcasts. So that's not your goal. But you can have both, because you're going to learn from at least my mistakes, You have to treatment plan both. Personal time. Look, does that make for a busy life? What do you want to do? Do you just want to wonder when it's going to get better, or do you want to make it better? You can make it better. I did it. And it's fun. It's fun to walk in a room and have supreme confidence. It's fun to walk in your office on a Monday and have people that think you're a star. I'm talking about your patients. Like, they're thankful that you took them on. This is doable, guys. It's doable, and we need to talk about it. We need to keep talking about specifically what we need to train in. Write to me if you want. I mean, don't just listen and say, take action. Now, if you don't know how to take action, write to me. If I have to even call you to do it, I will. Obviously, this is not just about my courses, which, by the way, you can find on the Rasner Institute, which are superb. But I don't give a lot of the stuff that you're going to need. So please take action. Thanks for listening. Do something. Let's make this your year, man. Let's make it the year you write to me and say, I did it, Raz. It works. I feel it. I feel it in the operatory like you said I would. I feel it in the case presentation moments. Have a great week. Let's make this happen. See you next week on The Lionhearted Dentist.